Hello, myself, Dr. Pankaj Shah. I am senior nephrologist at Marengo Sims Hospital. I was dean and professor of nephrology at Institute of Kidney Disease and Research Center, Institute of Transplant Sciences, and Gujarat University of Transplant Sciences. And I have fortunately rich experience of 40 years looking after kidney patients.
How does
Yes.
Imeglimin fit into your regular practice with the current landscape of T2DM treatment option? Kindly share your experience.
According to me, Imeglimin is a wonder molecule, and I am using it since its inception in 22, and this it belongs to Glimin group of newer Glimin group of drugs, and and it is a special boon for kidney specialist because it can be used up to CKD stage 4, while metformin and other some medicines, they cannot be used up to CKD stage 4. This is the advantage of using Imeglimin, and it has unique action of mitochondria, of improving mitochondrial function at cellular level. And as we know, mitochondria is considered is a powerhouse of the cell, and as it improves the uh, power of the cell, and that is how it improve the beta cell function and in treating type 2 diabetes mellitus.
In what specific patient populations do you see the greatest benefit of using Imeglimin?
Yeah, ma'am. As I said you that, ma'am, I am a nephrologist, and I am very much keen, and I am using this molecule in my kidney patient up to CKD stage 4. Over and above this, Imeglimin is beneficial for patients who have uncontrollable hyperglycemia with multiple metabolic dysfunction, such as those with significant insulin resistance or those at the risk of diabetic complications. One of the diabetic complications is diabetic kidney disease, and about 40% of the diabetics develop diabetic kidney disease or diabetic nephropathy, and 40% of my dialysis and transplant patients belong to diabetes. So it is a big and that number is increasing day by day, and that is why it is a big problem where I can use Imeglimin effectively. It also offers a promising option for patients who experience adverse effects like GI upsets with other medications like metformin or sulfonylurea, and also require additional glucose lowering agents to achieve target glycemic control. So, according to me, this is a breakthrough invention by Japanese scientists for the management of type 2 diabetes.
How does Imeglimin compare to other hypoglycemic agents in terms of safety and efficacy? Kindly share any real world case if you have.
Yeah, ma'am. As I told you, ma'am, that I am using this molecule since 22, and I am very comfortable and happy to use this molecule in my kidney and non-kidney patient. And in my clinical experience, incorporating Imeglimin as individual or add-on therapy to other hypoglycemic agents reduce the dose of existing medication, and it also help to reduce the dosage of insulin. Patients have shown improvements in glycemic control without experiencing significant side effects like GI upsets. It has proven effective in reducing the need for other diabetes medications, and even basal insulin doses can be reduced. In that way, as a nephrologist, I can call it a better metformin. Its dual action of insulin sensitivity, improving insulin sensitivity, and decreasing insulin secretion, insulin secretion, along with its mitochondrial mechanisms, as I said earlier, provides effective blood glucose control. Most important part to highlight is that imeglimin ensures glucose-induced insulin secretion as well as protects beta cell and preserves beta cell mass. That is the main advantage of using this newer group of medicine. Moreover, like metformin, imeglimin reduces hepatic neoglucogenesis and increases glucose uptake by the muscles. So it has multiple mode of actions to improve to look after a diabetic patient. Additionally, imeglimin has shown synergistic effect when combined with other anti-diabetic drugs. And so that is how it is versatile. It is a versatile addition to the existing type 2 diabetes management management regimens.
In recent times, Imeglimin sustained release formulation with Indian study has been launched in India. What is your opinion on that?
It is a great help to physician and especially to the nephrologist, because it will reduce the pill burden to my patients. My CKD patients are on many medicines. So by making it sustained release formulation, I can give only one pill a day, and that is how it will help me to control diabetes. Here I would like to add one more thing, that initially price was the factor. It was expensive molecule, but now Torrent and many other companies have come out with economic rate, and so this medicine has become pocket friendly also. Yes,
How
ma'am.
does the mitochondrial targeting mechanism of Imeglimin influence its clinical use?
Yeah, as I said earlier, ma'am, that mitochondria are powerhouse of the cellular function, and so improving mitochondrial function will be the great help in a care of a diabetic patient. Mitochondrial function is crucial for cellular energy production and metabolic regulation. In type 2 diabetes, mitochondrial dysfunction is a common underlying issue that contributes to insulin resistance as well as impaired glucose metabolism. By targeting and improving mitochondrial function, imeglimin addresses a fundamental aspect of the disease, helping to restore normal metabolic processes. This unique approach not only aids in lowering blood glucose level but also has the potential to improve overall metabolic health and reduce complications associated with type 2 diabetes. That is, moreover, ma'am, as with metformin, it does not cause hypoglycemia. So these are the multiple advantages of using imeglimin.
What are the
Yeah.
key safety and efficacy findings from clinical evidences on Imeglimin that clinicians should be aware of?
Yes, ma'am. With my experience, I can say that it is a safe, efficacious, and tolerable molecule. When it comes to the safety, there are lesser gastrointestinal side effects, and there is better tolerability. When it comes to efficacy, it is ideal for as an add-on or to reduce the dose of existing medication or insulin. Clinical studies have shown that imeglimin has a favorable safety and efficacy profile with significant glucose lowering effect and a low incidence of adverse effects. In that way, it is a new introduction. It is a groundbreaking introduction in anti-diabetic armamentarium. Its ability to synergize with other anti-diabetic agents enhances its appeal for combination therapy. Additionally, imeglimin's potential to mitigate diabetic complications such as metabolic cardiomyopathy, diabetic neuroinflammation, and uh, uh, diabetic, and also improving kidney function. It further supports the role of type 2 diabetes management.
Do you believe that Imeglimin has the potential to change the future landscape of diabetes treatment?
Yes, ma'am. According to me, imeglimin is a groundbreaking addition in management of a diabetic patient. So, imeglimin could significantly impact the future of diabetes treatment by providing a new mechanism of action that complements existing therapies. Its benefits in improving mitochondrial function and potentially reducing diabetic complications position it as a promising option for more comprehensive diabetic care. And I can foresee that this molecule is going to be a molecule of choice by diabetologists, endocrinologists, nephrologists, physicians, and almost by all, uh, and uh, and also by cardiologists. And its benefit in improving mitochondrial function and potentially reducing diabetic complication position it as a promising option for more comprehensive diabetic care. As research continues to unfold, imeglimin will become a cornerstone, as I have predicted, in the management of type 2 diabetes, particularly for patients with complex metabolic needs. Ma'am, when it came into the market, at that time in 2022, I had predicted this is going to be a breakthrough molecule in care of diabetes, and especially diabetics having kidney disease. And So it is a boon for our nephrologist community also. Imeglimin's favorable safety as well as tolerability and efficacy make it a valuable option in comprehensive treatment plans for type 2 diabetes. And as I know that, ma'am, now Imeglimin's acceptance is increasing day by day by physicians, diabetologists, endocrinologists, nephrologists, and cardiologists. And overall, it improves CKM health, which we know as cardiovascular, kidney, and metabolic health.
Any other key point or take home message apart from this you would like to give?
Certainly, for my nephrologist colleagues and other physician colleagues also, that imeglimin has to be number according to me number one drug in management of diabetic patients having other complications like diabetic nephropathy, cardiomyopathy, or other kind of autonomic neuropathy or other kind of diabetic complication. So it is going to be a molecule of choice by us. Thank you.